From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning and welcome to Medical Forum. I'm your host, Jeff Reed, and co-host Chris Mahr. Dr. Mahr, how are you doing this morning?
Fine, Jeff. How are you doing?
Well, you know what? I'm still battling this, can we call it the flu now?
Well, the flu is here.
The flu is here.
The flu is officially here. I've seen several patients in the last week testing positive for both type A, type B, and I said both, and the third, H1N1, which is the flu that made a lot of press about 2 years ago.
Really?
Yeah, H1N1 yesterday.
Well, you know, today we're going to talk about allergies, which is great. But I also want to, first of all, thank community broadcasters for having us and giving us our forum to talk about all the medical issues here around Sumter, Lee County, Clarendon, and Florence. And we venture into Columbia a little bit as well. Want to thank guest last week, Steve Dean. Boy, Chris, we talked about glaucoma. We talked about cataracts. He's such a talent and such a good friend. Yeah, I know
Steve,
you know him well.
Yeah, absolutely. Takes care of a lot of patients with me.
Yeah.
And I see him myself.
Yeah, H. Rubin, check him out in the mall. He's a great guy, 775-7877. But look, we've talked about on the show, we were talking about the flu season. And going back to November, we were preaching, get a flu shot, get a flu shot, get a flu shot.
Yeah.
And it was last week, the first sign of the flu coming out?
The first cases I saw were last week. I think there's been some cases reported in South Carolina for the past several weeks. The flu season has definitely been a little bit later this year than typical, which is great. Hopefully it'll be a short season.
Yeah.
Hopefully if we get a permanent warm-up in a couple of weeks, it'll be done. And so it could be a very short flu season, which is great.
Well, let's talk about that. All right. I'm out last week. I'm starting to cough a little bit. Me and you, I mean, we are guys that kind of walk off colds a little bit and such. Number one, to treat this, how important is it to get in to see you, and what are the symptoms? What's the difference between me just feeling under the weather and getting in there? What's going to be the difference for me to come see you?
So
here?
I think the way to discriminate the flu from just maybe the run-of-the-mill virus that is much less severe and does not require treatment. Symptoms of the flu are typically abrupt in onset. The gentleman I saw yesterday said, I was doing my job, I felt fine, and 15 minutes later I was feeling horrible. Felt feverish, had abrupt onset of muscle pains, joint pains, and so his symptoms were very quick in onset. So it's very typical for the flu. Abrupt onset in symptoms. Symptoms include coughing, runny nose, itchy, watery eyes, sneezing, especially body aches, joint pain, muscle aches, and fevers. You don't get the flu and have a 99-grade fever, typically. Typically, you're going to have a much higher fever. And, of course, adults typically don't have the fevers that kids get. So adults feel pretty bad at 101, whereas our kids, 102, 103.
Right.
You know, they notoriously will do well with fevers. But as adults, we don't feel well when our fevers are high. But again, most patients are going to have fevers, abrupt in onset. And so when you recognize these symptoms, the next question, the leading question was, how important is it to see your doctor? Well, if you are a healthy adult, no chronic medical conditions, does the flu need immediate treatment? Not necessarily, okay? So you can take Tylenol and Motrin at home, use symptomatic medications to remedy the symptoms like cough, runny nose, using over-the-counter medications. But the reasons to see the doctor and the reasons to get treatment is, number one, the very young and the very old who are susceptible to the complications of the flu, complications such as pneumonia. So a young child can get the flu. It can progress on to pneumonia, and they can become very sick. And in certain individuals, it can have deadly consequences, okay? Individuals who have chronic medical conditions, diabetes, heart disease, especially diseases like asthma, COPD, these are patients who are at much higher risk of the dangerous sequelae of influenza or the flu. So they need to be seen and treated much more aggressively than, again, back to that healthy young adult. So, again, if you have lots of risk factors, very young, very old, absolutely should see their doctor. Having said that, if you have abrupt onset of symptoms, you get in to see your physician, and a rapid flu test is done.
What kind of test, real quick? What happens when I come in your office?
Nasal swab. Just a Q-tip in the nose, swab the nose, and we usually get the results back in 10 to 12 minutes.
Oh, wow, that's soon.
And, yeah, very quick, during the visit.
Okay.
And if that's positive, we treat patients with certain medications that are antivirals. These medications will shorten the duration of your symptoms. They do not cure you. And it's a kind of a distinction I like to make to patients. A patient comes in with strep throat. We give them antibiotics. Usually within a day or two, they're dramatically better. Okay, sinus infection, a true sinus infection, they get antibiotics a day or two, they're dramatically better. The antivirals used to treat the flu do not have those type of results. They are used and they shorten the duration of symptoms. They have to be used within 24 to 48 hours of onset of symptoms, and they will shorten the duration of symptoms by about a day or so. So, again, you're feeling better a little bit quicker, you're getting back to work quicker. So, very useful. The other component about getting treated is that it may decrease the ability to transmit the virus. So you may not be as contagious as long.
So given my example, if I felt bad 2 days ago and came in to see you and the symptoms have been there over 48 hours,
I think
can these medications do a whole lot?
Treatment is futile, and I think all you're doing, if the symptoms have been there for greater than 48 hours,
right,
taking the medication, it may cut down on how long you're contagious, but it's not going to improve your symptoms.
Okay, now let me ask you one other question I get. How long does this last? To where maybe it's not just the flu, it's something disguising itself.
Great question. Can you tell? So 3 to 5 days you should start feeling better. Okay, 5 to 7 days. Significantly better. And if fevers, chills, cough is worsening or persisting for longer than 5 to 7 days, I would see your physician.
Okay. And
to look for other things. The main thing to remember now, a flu shot is probably not overly beneficial, maybe not a bad idea, but again, if you get your flu shot today, it's going to take 2 to 3 weeks to really start working. So not a lot of benefit at this point. It may protect you towards the end of this flu season, but the things you can do, hand washing. You should be washing your hands constantly.
Okay.
During these times of the year, I mean, you should just be washing your hands constantly. Maybe even avoid handshaking. If you shake hands, use antimicrobials after you shake hands, especially before you eat. Wash your hands before you eat. Avoid close contact with anyone who has flu or flu-like symptoms.
He is Dr. Chris Mahr. Thank you, Chris, for that. And we are Medical Forum, and when we come back, we'll follow up a little bit on the flu, and then we'll talk about something that hits home with just about every family, which is allergies. And we'll be right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
At Your Service Home Care provides in-home personal care, including light housekeeping, bathing and dressing assistance, medication reminders, meal preparation, companionship, transportation, and assorted other assistance to continue living safely and comfortably at home. At Your Service Home Care works with your local home health, hospice, Alzheimer's and VA programs, and other providers in the Sumter, Clarendon, Lee, and surrounding areas. Locally owned At Your Service Home Care is here to ensure you and your loved one continue to live your life with dignity and respect. At Your Service Home Care, 1250 Wilson Hall Road, Sumter, 803-607-9677. Please call, stop by the office, or visit www.ays-homecare.com and let them know how they may be of service to you and your loved one.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we are back with Medical Forum. We were just having fun at the break. I hope you all are having fun. Thank you all for joining us on this early, I call it early, Saturday morning. Anytime you got to get up before noon, it's early. And
Back to the college days.
That's right, on 105.9 Talk Radio here with Community Broadcasting. Also, if you want to catch us on Sunday, we re-air this great show, Chris, from 2 to 3 on Sunday afternoons. I do want to thank our presenting sponsor, At Your Service Home Care. They are your concierge, your steward, your guide to all home care and beyond. 1250 Wilson Hall Road.
Go over and see Christy.
Yeah.
Addis.
Sharon.
Absolutely.
Millicent just joined the team. Yes. Renee joined the team. It's growing. That's a fantastic business. 803-607-9677 or catch them on the web, ays/homecare.com. Let's just finish up on flu, cold, and everything. Give us
real quick high points.
Yeah.
Flu's here.
Am I lucky because I'm getting it early, getting it out of the way?
If you have it,
before March Madness.
There's 3 types. There's A, B, and then there's the H1N1. And you can get A this month, B next month,
serious?
and H1N1 the following month. So, less likely, but it's possible. But flu's here. I hope you all got your allergy shot, or your flu shots. I'm sorry.
You're jumping subjects.
I'm jumping subjects, sorry.
Easy.
My lead-in. If you haven't gotten your flu shot, it's certainly not going to hurt you to get it. Might be a little late, but if you have asthma, COPD, heart disease, something like that, just go ahead and get it. But now's the time to practice good hand washing. Stay away from people who have symptoms, things of that nature.
Gotcha. And kids are just going to volley back and forth in the house, right?
The kids are going to be. They're bringing it home from school. They're bringing it home from daycare. Yep, 'tis the season.
Gotcha.
We're here.
Gotcha. All right.
So all of you who get the flu and are miserable now, remember that in September when it's time to get your new flu shot.
All right. So, now March is right around the corner. Leap year this year, so we have an extra February day.
Extra February.
Yeah, Monday. Yeah. Mm-hmm. But as the Masters is coming up here in April, we're getting into March, we're getting into spring. Allergy season is upon us.
So the azaleas. We're talking azaleas. We're talking the. I was. Are
you going this year?
The Masters?
Yeah.
Well, I never know till the 23rd hour. Right?
Wow.
Well, if someone calls and says I have 2 tickets
then
for tomorrow, then I cancel what I'm doing. Anyone
listening, Chris Mahr is not going until you call and give him tickets.
Well, I missed the cut. And I think, did you make the cut this year, or did you miss the cut?
No, the Toomey Foundation exemption, where if you win it, you get into the Masters. I did not win this year, so it's over. I will be watching at home, gleefully.
My favorite place to watch the Masters.
Where?
On my couch.
I like it.
So at any rate, going back to the Masters, and that is just a perfect example. I mean, what a incredibly gorgeous golf course. I mean, it just walking around Augusta, and I had the privilege of walking around that golf course last year. What an incredible tract of land, and it's just an incredible garden is really what it is. You can go to a garden, professionally manicured garden, and it's equally beautiful.
Yeah.
So, but what we were talking about was the allergies.
Yeah.
And this is the
when
season.
did they start hitting us?
Well, this is the season that everybody associates with allergies, right? The flowers start blooming and the azaleas spring open, and everybody starts to get some allergies. One of the distinctions I want to make today is allergies are a year-long problem for many people. And allergies are not just from the flowers, not just from pollens. Allergies can be from a multitude of things. And actually, I think you did a little bit of homework.
Did a little homework,
and
Chris.
You have a great list there
of
some of the top allergies. While you're looking for those, I'm going to give you a couple of facts. Approximately 10 to 30% of individuals in the industrialized world, and the reason we say the industrialized world is there's probably a greater number of allergens that we have in the industrialized world because of the machines that we have versus someone who might be in sub-Saharan Africa who may not be as exposed to as many antigens. So that's the distinction they make with the industrialized world. 10 to 30% of individuals affected by allergies and allergic conditions, and the number's increasing. Every study I looked at, they all state that the numbers are increasing. So allergic rhinitis affects 20% of Americans. That's the old runny nose, itchy, watery eyes, nasal congestion that you get periodically throughout the year. Or again, some people will be affected continuously with this, and we'll talk about that in a little bit.
Okay.
Amazing number. We always like to talk about the effect on the entire country, but the economic burden, if you take into consideration prescription costs, physician visits, missed days at work and school, allergic disease exceeds $3 billion in the United States. So it's a big deal. It's really a big deal. Asthma, which is a component of allergy, we can talk maybe about this a little bit later, but asthma is the lungs manifestation of allergies, affects about 8 to 10% of Americans. Asthma costs are about $20 billion annually. Food allergies affect roughly 3 to 6% of U.S. children and roughly 1 to 2% of adults. And again, I can't say this enough, but it's every study I looked at, allergy percentages and prevalence are increasing. It's predominantly been the last 2 decades.
Is it increasing because we have more people, or why is it increasing? What do you think?
I don't have an answer for that.
Is it per capita or is it percentage, or just don't know? Is there more technology? I mean, are we finding out more things that?
Well, I think that's certainly a possibility. I think that diagnosis might be certainly more prevalent, meaning that we have the understanding of the disease process and we're actually diagnosing people with it at this point. But Jeff, your list. Let's hit your list. I thought that was a really good list of what we're talking about, what we're looking at.
All right, the number one. I have a top 10. I have a David Letterman top 10 list for you, Chris Mahr.
So let's start with 10.
You want to go from the bottom up?
In respect for the man himself, Mr. Letterman, let's start with 10.
Number 10, wheat. I guess this would include bread.
Wheat's an interesting allergy.
Who's allergic to wheat?
Well, we can talk about kind of two components. You can have an insensitivity to wheat, where it can cause just allergy-type symptoms in the GI tract. But you can also have celiac disease, which is a similar to an allergy where you get very serious sequelae from eating wheat, and that's the gluten in wheat.
Really? All right, I'm going to tell you what, we will start on this one, and then I think it'll take us into our first break, but also into our next break after that.
So we're at number 9.
Milk.
Number 9.
Number 9, milk. Lactose intolerance.
So again, you could have lactose intolerance, which is a bit different than a true allergy, because lactose intolerance is a lack of an enzyme that breaks down lactose and can cause GI symptoms. But you can also be allergic to milk and have an allergy-type symptom.
And butter would fall into that. Everything dealing with milk, or
anything that's
dairy.
So oftentimes, let's say just
cheese.
Lactose intolerance. Those individuals oftentimes have difficulty with cheese, anything, ice cream.
He is Dr. Chris Mahr. We're coming up on our second break here on Medical Forum on 105.9, and we are going through a top 10 list of allergies that may affect all of us. Be right back.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
I was Daddy's girl. He was my guide, confidant, and friend. We cooked out, fished, and talked about everything. He has trouble remembering those times now. I'm the parent and caretaker to my dad. He does remember losing his dignity each time he needs my help with simple daily care. Calling At Your Service Home Care was the best thing I've ever done for my dad. His personal attendant provides assistance with bathing and dressing, a compassionate presence for his safety, and even travels with our family. Having At Your Service Home Care working with me now gives my dad his dignity, and I can enjoy just being his daughter again. The wonderful people with At Your Service Home Care have the gift of caring for your loved one. If you have become the caretaker to a parent like me, contact At Your Service Home Care, 803-607-9677. Located at 1250 Wilson Hall Road in Sumter, or visit the website www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
And we're back on this Saturday morning with Medical Forum. Thanks for joining us today. Today we are talking about allergies. And we have left with Jeff Reed's top 10 list for allergies.
Not mine. I did my research like you asked me to, and we have our top 10 allergies. Number 10 was wheat. Number 9 was milk.
And number 8?
Associated with lactose intolerance. Number 8, very interesting one for any of you who've been bitten by a mosquito or a spider. Insect bites. What do you think of that?
Insect bites typically are from envenomations, meaning there's a venom or a protein toxin that is carried by certain insects, and you get an allergic reaction to them.
How do I know if I'm allergic? I mean, I get stung by a mosquito, it hurts. You get stung by a mosquito, it hurts.
So you get stung by a mosquito,
yeah.
The area gets red, hot, warm, and swollen. That is a reaction, okay? So that's that type of reaction is a mild reaction that is the same type of reaction you're going to get if you're allergic. But the allergic reaction, if you're highly allergic, meaning your reactivity is going to be significantly greater. It's going to be systemic. It's going to be more than just that one little bite on your arm that swells up. You might get that swelling on your chest, arms, face, shoulders.
Right.
You may have shortness of breath, wheezing, difficulty breathing. So
it's just a more significant symptoms there.
A more profound reaction.
Gotcha.
That's a reaction that can be associated with something called anaphylaxis, and I'm going to cover that in a minute.
Good. Number 7, soy.
Pretty interesting.
Yeah.
Pretty interesting, yeah. Soy. There's
now, people think of soy and milk. Are those one and the same or totally different?
Soy milk, yes. Soy is made from the soybean, which is actually very prevalently grown around these areas. And there's a lot of soy is kind of a healthy food, a lot high in protein, and there's a lot of products made from soy.
So number 7, soy. Number 6, dust mites. You see that a lot?
Absolutely. Yep. We're going to talk about dust mites a little bit later,
okay.
The reactivity to dust mites and the proteins associated with them. A lot of patients who have chronic allergies throughout the entire year. So it's not that individual who comes in and says, I get my runny nose, itchy, watery eyes, and nasal congestion 3 times a year. It's someone who comes in and has those symptoms continuously.
Huh. Number 5, eggs. How about that? Eggs.
Well, again, the GI tract can react to allergens as well.
Okay. Number 4, I think this is probably what most people would have said was 1. Pets. I'm allergic to cats, so that one hit home. Not just because I don't like them, because I actually like cats, okay. But I'm allergic to them, especially long-haired cats. You see that a lot there? Really, it's pets. It's pets in general, Chris.
Well, I have had patients who are allergic to cats and not dogs and vice versa. So, again, there's a distinction.
So you can be allergic to a dog and not a cat?
Yes.
Wow, what kind of person is that? Gotta love your dogs. Number 3. This one usually catches you at the wrong moment. Shellfish.
Absolutely.
Which constitutes everything, right? Crab, oyster.
Shrimp.
Lobster.
Yeah. It's oftentimes the iodine in the shellfish. And oftentimes patients who are allergic to shellfish are also allergic to IV contrast, like if they get a CAT scan. So the iodine in the shellfish and the iodine in the CT contrast.
So that's
association.
What's okay. Mm-hmm. Number 2, pollen.
Well, that's what started the conversation. But what's interesting to me is what 2 and 1. So I would have thought, most of us think pollen would be number 1, and number 1 is top 10 list.
Nuts. Yeah, nuts. Yeah, but you know what? You think about that with peanuts and
food allergies,
man,
very common.
It is.
And
poor kids.
And nut allergies can be life-threatening.
Yeah. So all right, so we have this list that is food, it's the atmosphere, it's our companions at home with pets. Where do we take this to start educating?
Let's just talk about what allergies are.
Yeah.
Okay, let's just break it all the way down to the simplest. What are they? Allergies occur when your immune system reacts to a foreign substance. So all of the substances that you just listed are foreign to our body. They are not part of our body. So we ingest them, we get exposed to them, they touch our skin, and our body recognizes them as foreign. Okay, we talked about all those like pollen, bee venom, pet dander. Now, the caveat is that in most people, these foreign substances do not cause a reaction. So in certain individuals who suffer with allergies, they develop a reaction, which is the allergy. Your immune system produces substances known as antibodies. Some antibodies protect you from invaders, like we were talking about flu earlier. Mm-hmm. So you get exposed to the flu or you get a flu shot, and your body develops an antibody. And so that when you're exposed to the flu the next time, it fights it off. And that's eventually how, if you get the flu, your body fights it off. But in the case of allergies, your body develops antibodies against these foreign substances and causes the reaction. When you have allergies, your immune system, again, makes the antibodies to the particular allergen as harmful. You have to be exposed to an allergen one time to develop an allergic reaction to it. So when you're a child and the first time you come in contact with, let's
take a peanut.
So
you're saying this how dangerous this is.
So you come in contact with that the first time, you don't develop the reaction, but then your body recognizes that as a foreign body, you develop antibodies, and then you get the reaction the second time. Okay? Your immune system's reaction can inflame the skin, inflame the sinuses, the airways, or the digestive system. And the severity of allergies varies from each individual. Everybody reacts differently and can range from minor irritation to anaphylaxis. And that's that very dangerous, life-threatening condition, allergic condition that can cause problems breathing and even death. While most allergies can't be cured, a number of treatments can help relieve the symptoms. Having said that, immunotherapy or allergy shots can decrease your sensitivity to the point where you are not reacting to them much at all.
All right, so let's. Do you find this mostly in children? Do we find out early in life, or do I get? Can I be a 50-year-old man and all of a sudden have lobster one night and shellfish
the second time have a reaction to it? So it is
or
possible.
40 years of none.
It's possible, but let's kind of talk about the factors that may cause you to develop reactivity later in life. Moving. Okay, so I may see a patient who has moved to South Carolina from Maine.
Okay.
And is now suffering with certain symptoms. Well, they may have been exposed to something that's in South Carolina that wasn't in Maine in the past. Now have since developed reactivity. Now they're down here full time, and so their symptoms are more apparent. So did they just develop this allergy all of a sudden? Not necessarily, but the circumstances can manifest the symptom more significantly.
We are Medical Forum. Dr. Chris Mahr talking about allergies. We've done our top 10 list, and we're going to talk about why you may catch allergies as you get older, and we'll be back right after this break.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Brooke Luce, Admission Instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we are back, Medical Forum. I want to thank one of our great sponsors, Medi Home Care, 905-7720 on 2560 Tahoe Drive. Do a great job with their sister company, Tri-County Hospice and Home Health. Been around, been a great staple in the community. Go by, support them. Their hospice is wonderful, their home health and durable medical equipment. Chris, when we left, we were talking about symptoms. How do I know if I'm allergic?
Yeah, so most people know a lot of the symptoms. I'm just going to go through this real quickly. Just remember that allergies can affect all parts of the body. Obviously, the eyes. We get itchy, watery eyes, redness of the eyes, kind of sore throat, nasal congestion, runny nose. Those are probably the most apparent, the most obvious. The lungs can cause wheezing in the lungs in the case of asthmatics. The skin. We forget a lot about the skin, but allergies that can coat the skin can cause eczema, for instance, which is a form of very dry skin that's allergy mediated. The gastrointestinal tract can be affected. So some of the symptoms to look for. Hay fever. Everybody thinks of hay fever. This is sneezing, itching of the nose, eyes or roof of the mouth, runny, stuffy nose or nasal congestion, and watery, red or swollen eyes. Now, Conjunctivitis. A lot of people are concerned about conjunctivitis. This is kind of a term that can be used with viral causes,
the gook in my eye,
bacterial causes, or allergies. So those red eyes that you wake up with in the morning, not necessarily that pink eye or bacterial, but can be a manifestation of allergies as well. Food allergies. Food allergies can cause tingling in the mouth, swelling of the lips, tongue, face, or throat, hives, and anaphylaxis. And I'm going to give a special. I'm going to talk about anaphylaxis in just 1 second, and because we've heard that term a couple times.
Mm-hmm.
Drug allergies, so you can take a medication one time, and then the second dose you can be allergic to it. We see this with penicillin. We see this with sulfa medications, for instance. Drug allergies can cause hives, itchy skin, rash, facial swelling, wheezing, and again, anaphylaxis. Atopic dermatitis. This is the skin's manifestation of allergies. This is the reddened, itchy, flaky, peeling skin. Again, those are associated with all of the symptoms of allergies. Real quick, anaphylaxis. What is anaphylaxis? If anyone has ever had anaphylaxis, seen someone with anaphylaxis, or had a child with anaphylaxis, they know very well what this is. This is a very dangerous, life-threatening condition. It is when the body creates an immune response that is so severe that the airways can close off, and it requires immediate medical attention. And when I say immediate, I mean 911, calling the ambulance. The ambulances carry special drugs to treat anaphylaxis, because oftentimes the drugs that they give in the field can determine whether the patient lives or dies.
What kind of time frame are we talking about here?
Minutes from the time they ingest so for instance, a child who ingests peanuts, and you know, most children who know they're allergic to peanuts, their parents do everything they can to avoid it. It's when there is something that's processed with peanuts, or there's a peanut
Go to a movie
something
theater,
else.
right?
Yeah, absolutely.
Get popcorn. It might have a little bit or something.
This is the type of reaction that patients often carry an injectable form of epinephrine with them, a little epinephrine injector, EpiPens. They're very simple to use. I advise people who are around children, like coaches, who may have a child on their team who has this type of allergy, and they're carrying EpiPens, learn how to use one. It's very simple. You pop the cap and put it in their thigh, inject it into their thigh. Very simple to use, but you'd want to take a look at how to use something like this before you'd have to use it the first time, so that you're comfortable with it. But being a physician, this is something I keep in my car. And if you're a coach, a Cub Scout leader, you're leader of a church group, and you are exposed to people who have anaphylaxis or are prone to anaphylaxis, be familiar with the use of an EpiPen.
Chris, that is a great point. I'm going to give an isolated story that is a very tragic story. A gentleman that did yard work for myself and a lot of people around here was mowing a yard and went over bees. I think they call them ground bees, if you're familiar with this. Mm-hmm. And they stung him, and he ended up dying from it. And he had like you said, he had the EpiPen? EpiPens with him, but they just couldn't get to him in time. And he got stung multiple times. He ended up getting to the hospital, but passing away just from the severity of the sting. So, very good point. We talk about defibrillators in schools and things like that.
Yes.
We don't even think to carry that. If I'm a Cub Scout, you're out with kids and you're doing an overnight, to have an EpiPen.
Yeah. And oftentimes, those individuals who are prone, they're going to have the EpiPens with them.
Because they know.
They might be in their gym bags or their backpacks or in their school bags, and oftentimes kids will keep one at school for the school nurse. But again, if it's something that you have never seen before, never used before, ask about it. We keep trainers in my office, and I'm always happy to show people how to use them.
Is that a prescription needed?
Yes, absolutely. And they, I believe they expire typically in about a year. So most of my patients, I write 2 of them. So they keep one at home, one in their car, one at home, and one at school. And they need to refill them every year.
Really?
Yeah, because they expire.
Take us through I'm a parent, and a young child may have reactions. What give us kind of an example, an illustration of when you see someone bring someone in that maybe is affected by this. How do I know if my child maybe just has a cold? Because allergies kind of disguise itself a lot.
Yeah, that's a great question, Jeff. And a lot of people are thinking, gosh, I'm getting sinusitis 4 times a year. I see that all the time. And we have to think about things like allergic rhinitis, that it's not just an infection 4 times a year. It's not that you're getting a virus every 2 or 3 weeks. It's not that your nose is running constantly. So those are the type of things to think of, to think about as the cause being allergic rhinitis or allergies.
Right.
That there's more persistence to them.
Now, what do we do once you discuss? What kind of test do we do?
So, great question. Oftentimes, allergies are just treated symptomatically, meaning we don't really test for them. Okay, there are tests, and we're going to talk about that in a minute. But oftentimes, we just treat them. And one of the reasons is there is such a prevalence of treatments that are over the counter. You don't even have to see your doctor anymore to do a trial on medication. In the past, people use Benadryl, but Benadryl you have to take several times a day. It's very sedating. Okay? So it's one of the reasons Benadryl is not as good of a drug for chronic allergies. The newer drugs, which are called non-sedating antihistamines like Claritin and Zyrtec, are excellent treatment. You can use those over the counter, but we're kind of running out of time here. Let me talk about that.
Let's come back. Let's take a little hard break here, and we'll be right back because I think that's very important when we talk about some of the over-the-counter drugs that we have, and we'll be right back with the Medical Forum.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
This is Brooke Luce, admissions director with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
Welcome back to Medical Forum. Thank you all for joining us. And again, if you catch some of the show or want to catch all the show, again, we re-air on Sunday from 2 to 3. Talking about allergies with Dr. Chris Mahr. Pick up where we left off, Chris.
Well, we were talking about treatment of allergies, and I was saying that oftentimes individuals will treat their allergies before they've seen their physician, before they've even been tested for allergies. So there are so many allergens that you can react to. Oftentimes, you manifest these symptoms. You think that it may be allergy related, and you use some of the over-the-counter remedies. Again, Claritin, Allegra, Zyrtec, great over-the-counter treatments for allergies. Most of them are not very sedating, so you can take them in the morning. Zyrtec is
Are they kind of universal? Meaning, so if I'm allergic to hay fever, they're
going to treat the reactivity to whatever you're allergic to. So they're not specific to a specific antigen. Meaning, if you're allergic to wheat, if you're allergic to pollen, if you're allergic to shellfish, mold, spores, grasses, whatever. Well, shellfish is different. You're certainly not going to want to have a shellfish allergy. Take Claritin and then try to eat shellfish.
Okay, just stay away from
food allergies can have a higher association with anaphylaxis.
But for the most part, when we're talking about
pollen, mild
hay
symptoms, hay fever, and we're talking about molds, grasses, dust, pollen, cats, dogs, cockroaches, all of those things.
Okay.
So you have your symptoms; they're mild. You want to try something before you see the doctor. Claritin, Allegra, Zyrtec, they're pills. You take them once a day. Zyrtec's a little bit more sedating than Claritin or Allegra, so I usually suggest it's taken at night. But you try these modalities for a couple of weeks and see if you're better, right?
Okay.
Oftentimes you can take these medications certain times of the year. So if you're allergic to ryegrass, right? And ryegrass down here in the South grows in the South, so your symptoms might be when you're cutting the grass in the wintertime.
Okay.
And so you might just need your Claritin then.
Okay to take it every day? Or
absolutely.
Okay, and almost encouraged to do so, right?
During the period that you're affected.
Okay.
Newer treatments over the counter, now these are treatments that have been around for a while being prescribed by physicians, but newer treatments over the counter are nasal steroids. So Flonase has been recently approved for use over the counter. Nasal steroids are sprayed in the nose every day, and they reduce the reactivity in the nose by the steroid shrinks the inflammation, okay? So, again, if you're going to use nasal steroids, they have to be used properly, follow the instructions, and you have to use them every day. If you wait till you have symptoms to use a nasal steroid, it will not work. You have to use it every day. It takes 2 to 3 weeks to start working, and you need to use it continuously.
Is that also what a Zyrtec too? I think you kind of build up. Does it take a little while, some of these?
Well, usually Zyrtec, the pills are going to work a little bit quicker than the nasal sprays. But you can use the combination of nasal sprays and the allergy tablets.
Okay.
For prescription, there are some other nasal sprays like nasal anticholinergics. There are nasal antihistamines. There's some different nasal sprays. There's some newer antihistamines that are prescription only. And then there's a medication called Singulair that can be used for very severe refractory allergies. Last but not least, if your allergy symptoms are refractory to everything, oftentimes we do skin testing. We do skin testing at Colonial Family Practice. It is very, very easy. I did several skin tests last week on patients.
Talk us through it.
So patient comes in, we identify their allergies. We typically don't do skin testing immediately, so we might try a Claritin for a week or two, or maybe some Flonase for a couple weeks. And if they're refractory and we really want to get to the heart of the problem, we do skin testing. Patient comes in, we have these little plastic applicators that test for 60 different antigens, 60 different foreign bodies, everything from grasses, molds, cats, dogs, cockroaches, molds. I think I've got got it all. And we scratch the skin. The reagent sits on the skin for 20 minutes, and we read the test, and it tells you when you walk out of the office what you're allergic to.
So I can come in for my visit and get tested for up to 60 different
allergens.
No, before I leave.
Absolutely.
Wow.
The only thing is you can't take your Claritin or Benadryl a week before you get your allergy test.
Because it
won't react.
Mask it a little bit.
Yeah, exactly. And at that time, we can often determine whether or not you need allergy shots. Allergy shots you do for a year or two, and oftentimes, actually, it's for anywhere from 1 to 4 years, allergy shots, but that will get rid of the allergies. Period.
Wow.
So, it'll decrease your reactivity to them, so that you oftentimes don't need medications.
I got you.
We're running out of time. I want to get through this. This is a list of things that you can do in your home to reduce allergies, okay? Where are allergies found? Oftentimes in the bedroom. You spend a lot of time in the bedroom. You can encase pillows and mattresses and box springs in dust mite-proof covers. Wash sheets frequently in hot water. Flooring, remove carpeting. Use wood flooring, hardwood flooring. Cleaning frequently, using high energy or HEPA filters in
it's great for mold.
Exactly. Curtains and blinds. Use washable curtains. These things can hold allergens. Close windows and rely more on air conditioning because the allergies can come into the house, the bedroom. Choose easy to clean chairs. Remove clutter. You've got clutter in your bedroom, clutter around your house that collects dust. That's a place where dust mites proliferate. Air filtration systems. There's a lot of controversy on how well they really work, how well one small system is going to work for the entire home. But certainly using HEPA filters or good furnace filters will reduce the allergies in the air. Pets. If you come in, you're tested positive and you're allergic to cats.
Wow.
Sleeping with your cat,
you're done.
Is not going to get rid of it. So,
I'm allergic to cats, and I mean, literally, I can't even breathe.
So,
yeah, I mean, it literally will knock me out. Removing the cat has not solved it. The cat is still there.
The dander, yeah. So, usually, if patients are allergic to their pets, I just tell them no pets in the bedroom.
Wow. Oh, absolutely. Let me ask you this. If you were going to buy a house, I know we got like maybe a minute left here. All right, if I'm buying a house and cats and animals have been in there,
yeah.
What do we do?
You're really replacing the carpets.
Yeah.
Because I steam cleaning them and using professional cleaning services at the very least. But arguably maybe replacing the carpets, especially I always tell patients, think of your bedroom the most, because what room in the house do you spend the most time?
Right.
You go into your bedroom, and it's probably the only room that you spend a solid 8 hours in. So that's the room that we need to cut the allergens out the most. That's why the coverings on the pillows.
Yeah, I think you make a great point. I mean, when we look at allergies, a lot of times outside the house, if you live in a shaded area, when we talk about molds and such like that, it is just something that we don't think about. But man, time flies by.
Yeah, there's allergies you talk about.
We could probably do this for another 3 shows.
Again, just look online. Try to get your bedroom up to snuff. You spend a lot of time there. Just sometimes putting that, encasing your pillow in a dust mite proof cover makes a difference. Your face is on the pillow 7 hours a day. He's Dr. Chris Mahr, and we are Medical Forum, and we thank you all for listening in. We have our top 10 list. Did you like the top 10 list, Chris? I like the top 10 list. I like that. I miss David Letterman. Yes, I do too. Go see Dr. Mahr, get allergy tested, and hey, that could be it's a huge problem out there, and might be the difference between your kids being effective in school as well. Absolutely. So, all right. And thanks, we'll catch you next week. All right. Good weekend.